My name is Lisa Corken. I'm a physical therapist at Altitude Physical Therapy.
And I'm Knighton, also a physical therapist at Altitude. And we wanted to give you guys a presentation on what, as physical therapists, we look at when we do a bike fit assessment.
And so we're going to answer the question for you, hopefully today, do you fit your bike or does your bike fit you? So one of the things that we talk about with a lot of our patients is how common cycling injuries are. And through these 3 studies, you can see that they are very, very, very common between amateur cyclists and professional cyclists. One study of 518 showed 85% with an injury, 108 in one season had 58% experience an injury, and then 51 pros over 4 seasons, 63% reported an injury. So then we get into which ones are the most common. So definitely the neck. You can see in the pictures to the right there that the neck is strained in certain ways on a bike that we can help you with posture and supplemental exercises. The next thing that often pops up is knee pain, which we can show you through video analysis later. We have an example at the end of the presentation. Then we get groin, buttock pain, the hands. Biggest thing with the hands is that they go numb, and then low back pain. So we're going to talk to you about anatomy. It's sort of our area of expertise. We consider ourselves movement specialists or movement experts. There are certain muscles in our body when we cycle that are more vulnerable to injury because they do more than one job. And a lot of that is because they attach across multiple joints. So I like these side-by-side pictures of the neck. The one on the left here is the posterior view of the neck. It just shows how complex and really how many muscles are there in the back of the neck, ultimately to get injured. A lot of times neck injuries, this is where patients will describe where they feel it is in the back of their neck or the back of their head. The picture on the right here shows the anterior image of our neck. Now, the anterior image or the front view of the neck is a little tricky, so the esophagus and the trachea have been removed. And there's really, really small muscles in the front of the neck that we call the deep neck flexors. And these are essentially the core muscles of your neck, much like the abdomen has, or the trunk has your abdominals and oblique muscles. These are doing the exact same job. It's just a little different perspective because they're not covering any organs. They're very much on the spine. And these muscles are huge muscles for us to target in cyclists who prefer to use all the muscles from the picture on the left versus any of the muscles pictured on the right. Then we talk about the unobvious core. So I just mentioned the core of the neck, which are those really deep muscles in the front. And then I also mentioned the abdominal and oblique muscles, which is very common for us to think about stabilizing the trunk. When we talk about our unobvious core, what that means is we talk about things like the diaphragm. The diaphragm is this huge muscle that really encompasses a lot of our trunk, and it helps with our breathing. So that's something that we can talk about in terms of your posture on the bike. And then we also have all these other muscles that attach to our lumbar spine, kind of like the sneaky ones in the neck. So you have your hip flexor, your iliopsoas muscles that come up and attach to your lumbar vertebrae. You have your QL, which is where that number 3 is on that left side. And then pictured on the right, we have the trap and the lat. I mostly talk about the lat with cyclists because it comes into play with the shoulder and more upper body positioning as well as low back. You can see that the lat attaches all the way down to the hip bones and the lumbar spine. Then we get into the hip, knee, and ankle. So here pictured is our upper leg and hip joint. The quad here is what we would call a two joint muscle. One of the quad muscles crosses both the hip and the knee, so it can often be an irritated issue for us. And then the hamstring really is the other big one. It goes from the ischial tuberosity down to the knee, so it can really affect rotational components in the hip as well as issues with tracking in the knee. Now the real question is do we use all these muscles when we're cycling? That's where we come in. So the answer is no, but we should. So when we watch you cycle, what we can really see is, are you using the muscles appropriately? Are you in the appropriate posture for efficiency and motor control to reduce your risk of injury and allow you to cycle with significantly lower injury. Then we talk about lumbopelvic rhythm. This is a big one that we assess on the bike because we're leaning forward over the handlebars. And a lot of people will think, why is hamstring length important? Why should I be able to touch my toes? All that kind of stuff. And what it really comes down to is the ability of both your spine and your hip to be able to bend you forward. I really like this picture because in the picture on the way right, you can see that, the patient is really hinging at her hip and her low back is very, very, very straight. In the middle picture, you can see that she's only bending from her spine and her hips are not rotating at all. The first picture is the more ideal component of lumbopelvic rhythm, where you get contributions from both the lumbar spine and the hip to help with that range of motion. And just, to translate this over to cycling for you, this is the equivalent of when you're on your bike and your knee is coming up towards your chest. That's the motion that we're trying to analyze.
Okay, so a common question that we get is, what really is compensation? So there's a couple things that can happen, and one is if one muscle is weak, another muscle that performs a similar action that complements it has to take over and be that dominant movement. The other reason is our muscles fatigue at different rates. And so if one muscle fatigues faster than another, it's going to result in over-recruiting that stronger muscle as well. So we have weakness and we have fatigue. Now, if we think about cycling, over a 2, 3, 4 hour ride, you're doing tens of thousands of repetitions. And so if we do those repetitions over and over and over again, that pattern now becomes a little bit more ingrained into your brain. That's what we call that neuroplastic change of the brain. And that creates this lasting compensation.
One of the things that Aaron always talks about with his patients is he likes to use the term misuse injury versus overuse injury. And so that's kind of what he's talking about here. So
in compensation patterning, as I mentioned, if this continues for a long time, the pattern gets learned in the brain, and it's very difficult to get untrained. So it requires a lot of specific exercise to rebalance this muscle activation. And well, this is where we as PTs come into play. We're not bike fitters, but we can definitely see the different firing patterns and where you are losing power or overactivating a different muscle that's causing some of that discomfort that you may be getting. As Lisa mentioned, a misuse versus an overuse. It's just because that one muscle is getting worked a little too hard. So one of the things that we forget about is how much range of motion each one of these muscles and our legs have. So what we need to do is train these muscles into the range at which they need to work. So let's look at the psoas, which is part of that unobvious core Lisa was talking about. It's one of your hip flexors, and it's the main hip flexor. So in extension, which is when your leg is coming behind you, as cyclists, we don't ever really get there, but you require about 30 degrees. Well, then it also requires 120 degrees of flexion. So that's that knee coming up towards your chest. So if you think about bringing yourself up to the 12 o'clock position of the crank cycle. But if your hip can only go to 90 degrees, there's this 30-degree part that's untrained motion from 90 to 120. What can happen with this is if that hip doesn't want to move, that extra motion to get from 9 o'clock to 12 o'clock in the crank cycle, it has to come from somewhere else. And so we're going to talk a little bit about what that compensation could look like. And in this, we get the question, isn't cycling enough to keep me healthy? Well, unfortunately, the answer is no. And so it requires a lot of extra resistance training and mobility training to keep yourself healthy. So going back to that unobvious core that Lisa was talking about, do we really need a six-pack? Do we really need abdominals to ride a bike? And the answer is, well, you don't necessarily need a six-pack, but you need to know how to use your core. And so something we mentioned is called proximal stability for distal mobility. And just because we're sitting on a saddle doesn't mean that we don't have to stabilize our core. So without that solid core, our lower extremities, our legs, they don't have this solid surface to move off of. And so this is getting into that compensation that we were talking about. Because that psoas muscle can be used in your unobvious core, if it's not trained well, that knee won't come up high enough to clear the crank cycle, which then can come into your lower back and you get that pelvic rocking motion, that pelvic rocking compensation. What this then means is those muscles are starting to work overtime and will fatigue out faster. But if we start working on your core stability, we're now trading that muscle activity to where it's more appropriate so that the legs can move more efficiently. The other piece where this comes into play is we start to have increased level of shoulder and neck pain because we're starting to rest on the bars too much. We're using the bars to hold our body up instead of our core. So a test I like to give my athletes is, I call it the hand lifting test, and it's when you're in your position riding, try to get your hands as gentle as you can on the bars and even lift them up a little bit and see how hard it is to actually stabilize that, or if you can hold yourself there. So going back to neck pain, since we saw that almost half of cyclists have neck pain, one of the big pieces is the bike fit. As we mentioned, we're not fitters, but we can see how your body moves and also work with your fitter to make suggestions. So the more aggressive your position, the more neck extension is going to be required. So if you have too much reach, or your saddle is too high, or even the bike is an incorrect size, in order to look forward down the road, you're going to have to crank your neck up even more. Some other pieces that we don't ever think about is the weight of your helmet and glasses and how those are positioned. Your eyes are going to play a big portion of where your head gets positioned when you ride. And so something that a lot of competitive cyclists look at is, I need to be as aero as possible to go as fast as possible. But if you can't hold that position long, that's not very aerodynamic anyways. So we need to find that balance between aero and comfort so that you can be able to ride for a long period of time. And if we need to get more aero, let's address the body so that we can get there and not just force you to get into this position and cause pain. So why does my neck still hurt? There are anatomic variations. So, restriction in the hips can impact the pelvis and the low back, and this can translate all the way up the chain. One piece, even though it may seem isolated, can impact something else. If you have the middle portion of your back, your thoracic spine, if it's too tight, your neck is going to have to take over for that to look down the road more. And then finally, if your neck muscles are too tired and they fatigue quickly, kind of like those deep neck flexors Lisa was talking about, the abdominals of the neck, if those aren't trained well, all these other neck muscles have to take over to hold your head up. If we're going for a 3 or 4 hour ride, that's a long time for a muscle to be working. And something that we've noticed in clinic is now coming into some shoulder weakness. So this muscle called the serratus anterior, which helps stabilize your shoulder blades and keeps you propped up strongly on the bars. So then we come into low back pain, a common piece that we have a lot of cyclists come in with. So anatomy and bike fit have a big component. As we've talked before, the hips and the low back have to work together. So if you have too much of an aggressive position, you're going to be bent forward too far, and that low back is going to be bent over, which is lumbar kyphosis. And so a suggestion that we make is you have to adapt into this position. If you just go to a slammed stem right away, you're going to have some discomfort. So it's taking the time and being honest with where you're at and allowing yourself to adapt into a new position. But then if we look at how far we've cycled, in one report, on average, cyclists who rode over 100 miles a week are 3.6 times more likely to report having low back pain. And so is it really the posture? Well, it's not necessarily the posture itself, but how long you stay in it. So transitioning between the hoods, the drops, standing, sitting, being on the top bar, things like that, all can make changes so that you don't get as much low back pain. And then finally, as we talked about before, and we are kind of hammering, getting your core to engage while you're on the bike. So there's a couple things going down the chain, talking about hip pain. As we've mentioned more and more, hips and low back are combined. Something that can happen is called femoral acetabular impingement, and that's an actual bony abutment that happens in the hips. When this happens, it's usually because of repeated stress with bringing the knee up. It can be caused by a muscle imbalance, where we have weak glutes and too strong of hamstrings, and a weak hip flexor as a psoas, and the TFL, which is more on the outside of your hip, is a little bit overactive. So that's one of those muscle imbalances as PTs that we try to help get squared away so that you don't have pain in the hip. And then also with the knee pain, it's one of the primary joints for energy transfer through the pedal stroke, and we mostly think of it just as this hinge joint that goes back and forth, but it also has a slight rotational ability. And one of the pieces that we mentioned is it is the unfortunate joint between the hip and the ankle. And so if there's something going on at the ankle joint or the hip, because they have such greater ranges of motion, the knee is usually where those pieces show up. So whether it's a muscle imbalance or an actual range of motion deficit, the knee usually takes the brunt of those, and that's where you feel that pain. So that's, as a therapist, what we're able to take a look at is, if it hurts here, what else is going on and what else is occurring to cause that pain?
So these are just a few videos of a recent bike analysis that I have performed in the clinic. This patient gave us permission to use his videos. I did block his face out. Ultimately, we ask you to bring your own bike in, and we'll take video of you from the front and side and the back. And like I said, what we'll do is we analyze you on your own bike. So we are not bike fitters. This patient had his bike fit. He wanted to see what he was doing on his bike, so he came in, we recorded him. And this is ultimately what I would say I'm seeing from the front. So in full speed on the left here, if I'm watching him, I'm seeing his head and shoulders rocking side to side. I can see he's dropping toward that right side a little bit more. A little history of this patient: his pain is right SI joint pain when he rides, but I can also see how his knees are tracking in this position, how much he's dipping his head or neck, which you can't really see with the blackout of the face. And then I slow it down. I see, I can gather more information. How far to the right versus the left is he leaning? How much are his knees tracking or going in circular motions or not? He may have very good motion. And so this is just the frontal view that we would take. And then the next slide shows his lateral or his posterior view.
I think it's important to note that this gentleman is an experienced cyclist, so it's something that you can ride with for a long time and not know that's going on and have something just creep up on you.
Mm-hmm. So here's his full speed motion from the behind. I normally can see more personally from the posterior view than really any other view. This view, I can really see that he's rocking to the right side as soon as that knee comes up into that full crank position. So I know he's doing something for that right hip, right SI joint, right low back. And then when we slow it down on the right side, it just becomes even more clear. And the nice thing about slowing it down is that then my patient or the client can see it. And that's what's bigger and better for us. And we can even, for him, now that I'm looking at it again, Aaron, can you play that one more time? Mm-hmm. You can actually see his calf activation is a little bit different, which is not something that we worked on, but his right calf really engages on that right downstroke versus his left one. And, that's just something that we can see because he's pretty defined. And like Aaron said, he's an experienced cyclist. This is the view that we look most at that lumbopelvic rhythm. The hip and the back, they go together hand in hand. So like I said, he has right SI joint pain. So if we let's watch his full speed. Yeah.
It's not playing for us.
Oh shoot. Okay. So watch his slow motion speed. So you can see we're looking, at that moment when his right knee comes up. It's hard to see on this side since his right side's on the other side. There's something he's avoiding. His left side, all things considered, look really great. So I know that his bike is probably fit really well. I also know who fit his bike, so I know they did it just fine. And the patient told me these were my goals. I'm not racing for speed. I'm not riding for anything crazy. I just want to be able to ride and be efficient, but not hurt myself. So his thing that we worked on was actually hip range of motion in that right hip. He was really limited in right hip internal rotation. And I didn't post the after videos of this, but what I did is I worked on his right hip internal rotation in clinic, took a video afterward, and his, rocking or avoidance of that right side significantly reduced, and he felt like he was able to more efficiently use both legs. And that's another kind of tip that I'll give my patients is that if they feel like they're using one leg more than the other, a lot of times I'll have them ride on a flat road and unclip a foot and see kind of what they feel just pedaling with one foot, for a minute, 2 minutes, however long, and then do the same thing on the other. And sometimes patients will use that as an exercise of, okay, like I definitely am way more comfortable cycling with my left leg than my right leg, and then that helps us also supplement exercise programs. So we just kind of talked about this a little bit. So the case on the left was one of the patients I just talked about. He did not need pedal spacers, but I did have another patient who looked more like this picture. This is not my patient. This is just a picture from, what did it say? Image from United Endurance Sports Coaching Academy. But you can see that he's really, really frog-legging his stride there. And so what we did with a patient of mine who looked like that is we actually put pedal spacers in, and we just moved his foot away from the bike a little bit. And that really allowed his hip and knee to track more straight, which took a lot. He actually also came to me with low back pain, but this was his solution. And then another patient I had was an Ironman athlete with right shoulder and neck pain. And what was happening was he didn't have the appropriate shoulder stability. So we gave him this serratus strengthening that Erin mentioned to help stabilize that joint so that there was less work needed in the shoulder for him. So we did a lot of plank work, a lot of core work, like we are always talking about in this entire lecture. And it really helped him. One of the tricks that I gave him on his bike when he would start to feel the pain is he would feel it in this position, in this arrow position, as I would tell him to activate his shoulder by almost actually trying to slightly pull the arrow bars apart. And that is what we call a slightly external rotation isometric exercise, and that engages the serratus in this particular posture of the body. And when he would do that, he told me, he's like, if I did that, his pain would go away. So we knew that that was an area that he really needed work.
So a couple ideas just for some strengthening, going straight off of that serratus anterior. A lot of people like push-ups, so just add a little plus to it. So I call these a straight elbow push-up, and it's basically you don't bend your arms, but you move your chest towards the floor and then away from the floor and get that back rounded out. And that really specifically focuses on getting your serratus anterior. Another exercise that we can do is working on just strictly working with planking. But if you give yourself some things that are unstable, like putting your arms onto a stability ball, the core is going to have to work a little bit more. You can actually incorporate the previous exercise with this one to work your core and serratus a little bit more, either rolling the ball out and back or doing those push-up plus. Or you can also put that ball under your feet and work on knee drive so that you get a little bit more kind of cycling specific in pedal motion. And then finally, working on some lunges with knee drive like we talked about. We want to get those hips to go through the full range of motion. Being able to stabilize your core and your pelvis and let the hips move independently, whether it's through that lunge or also at the bottom you see with a bridge on a ball. Those translate really well to the bike with getting a good closed hip angle and getting a good glute drive. So takeaway points. It's not necessarily as easy as riding a bike. Cycling is a more complex sport than we think. There's a lot of unrelated aspects that may contribute to pain. A thorough analysis is necessary to see what is the cause. I have a lot of athletes that come and be like, hey, I've had 5 different bike fits and we still can't figure it out. Sometimes it might not be changing your saddle height by 2 millimeters. Sometimes it means that we have to work on some strengthening and some range of motion exercises to get you moving better. And then the exercises that we talked about, they're just meant as guidelines and ideas. They are not prescriptive. So if you do have pain or anything you just want to get checked out, give one of our clinics a call, and one of our therapists can take a look at you and help get you pointed in the right direction.
Yeah, just another closing remark, kind of just as Erin mentioned, 2 millimeters here, is that going to be it? I would say more often than not, bike fitters are very good at their jobs. It's intense coursework, and they do a really good job. So when someone comes in and tells us that there's something wrong with their bike, that's kind of answering the question to our topic today, or the very first slide was, do you fit your bike or does your bike fit you? We come in and we say, do you fit your bike? The bike fit, I mean, and Erin maybe agree or disagree, I rarely ever change anything on the bike. I almost am always working with the person's body first.
For sure. Usually people are coming in with pretty solid fit on their bike, and it's just it's those last little bits that we need to now say, like, okay, how do we get your body to just work a little bit more efficiently?
Yeah. Is that our last slide?
I think that is the last. There's all of our references.
Thanks for listening, everyone.
Thanks for listening, and give us a shout if you have any questions.
All right.